Dr. Monica Peak was the attending physician for a patient with a serious condition. The patient refused care from Dr. Peak and her team and issued a written request for a white physician.
That the primary thing on his mind was not his health, but his racial prejudices towards persons of color who are caring for him. It was August 1st.
It's an open secret. Credentials don't protect physicians of color from experiencing racism, and there isn't an official national policy to help doctors deal with patient prejudice.
Did that catch you by surprise when you first saw that complaint?
It did not catch me by surprise because, again, I've had experiences like this throughout my life and throughout my career in medicine, starting as a medical student. But it was disappointing.
A recent study found that 6 in 10 doctors surveyed had experienced some sort of biased remarks from their patients about their gender, ethnicity, race, age, or weight. About 16%, or 160,000 physicians in the U.S., are Black or Asian. And yet the study found the majority of them are targets of patient prejudice when compared to other physicians.
You can't go to a restaurant and say, I don't want to be served by any, Latino waiters. That would violate Title II of the Civil Rights Act. So I thought it was odd that here we have in the medical context this happening all the time.
It's called informed consent, when patients learn of their condition and give consent to a doctor for treatment. Patients have the right to refuse care by a physician, but what if a patient refuses care due to bigotry?
I've been an African-American woman my entire life, and so experiences that I've had as a physician with racism are not entirely different than experience I've had as a regular person with racism.
The patient was transferred to the intensive care unit, the ICU, not because of his complaint, but because of the severity of his illness.
The white coat, the hospital walls, they don't protect someone from racism.
Mm-hmm.
How does it impact physicians, or more specifically, how does it impact you?
It has been one of the greatest joys of my life being a physician. Can we pause?
The New England Journal of Medicine says for minority healthcare workers, patient expressions of racial preferences are painful and degrading and can contribute to moral distress and burnout.
Have you ever wanted to stop being a physician?
It has never occurred to me to stop what I'm doing.
Good. Good.
Life is full of challenges. I know the road that is behind me, that my foremothers and fathers sort of fought to pave the way for me. And so my road has certainly been easier than people who came before me. My road will hopefully be more difficult than those who come behind me.
The article, co-authored by Paul-Emile, aims to help physicians deal with discriminatory patients. Its flowchart offers options for moving forward with care. For example, if a patient request is bigoted, the chart suggests options to accommodate, transfer, negotiate, or limit unacceptable conduct from that patient. Paul-Emile admits that a request to be reassigned to another physician isn't always discriminatory or racist.
It might look like bigotry and animus, but it could be something else. So, for example, it could be that the patient is a war veteran, and the physician reminds them of a former enemy combatant. In situations like this, it could be bias, but it could also be PTSD.
The bigger, more important issue is what happens when patients are the target of racism. Structural racism, interpersonal racism, because they're the ones who are sick and vulnerable entering the system and really need help. All right, let me just take a quick listen to your chest. Lungs sound great. And the problem is not going to be solved unless we all roll up our sleeves and get to work. So that's every person. That's every white person, that's every straight person, every person.